Great. So hello, everyone. Liat and Sydney here from Hyro. Welcome to our annual virtual summit, Digital Front Door Day.
I can't believe that it's been a year since our last virtual summit.
I know, crazy. A lot has developed around the digital front door in healthcare, and that's why we're here today. And we're kicking things off with our very own CEO and co-founder, Israel Krush. Israel, the mic is yours.
Thank you so much, Liat and Sydney, and hi everyone. Excited to be here. Good morning and welcome to Hyro's second annual virtual summit, the Digital Front Door Day. I'm Israel Krush, co-founder and CEO of Hyro, and I'm thrilled to kick off this exciting day filled with jam-packed agenda. We're especially excited to announce that we've doubled the number of speakers this year, 45 to be exact. Some alumni and some new this year, bringing you even more insights, expertise, and fresh ideas around our 2024 theme, Responsible AI, a topic that is reshaping how we approach healthcare's digital front door. As you review the agenda, you'll find a wide variety of sessions covering everything from patient access, web user experience, and call center automation to success stories, case studies, and emerging tech trends in healthcare. These sessions are brought to you by industry visionaries and innovators who are setting new standards in healthcare and patient access. While all of today's sessions will be recorded, there's nothing like being part of the live conversation and asking your questions. So please try to join us live whenever you can. Now, without further ado, I'm honored to introduce our keynote speaker and the opening note for the conversation, Amir Dan Rubin. Amir is the CEO and founding managing partner of Healthier Capital and former CEO of One Medical. His vision for innovation in healthcare has inspired many, and we're fortunate to have him with us today. I've met Amir both virtually and in person, and in every one of our conversations, I was inspired and excited towards what's next for healthcare. Amir, it's great having you here.
Israel, it's so great to be here. So great to be with you and the Hyro team. I'm excited about the conference, and thanks for having me.
Absolutely. So, all right, we can't really kick off an entire summit called Digital Front Door Day without talking about the digital front door. And I believe you have an incredibly unique perspective on this topic, having been on both sides of the table. Well, actually, it's probably more like four corners of the table, right? So you've been a CEO of Stanford Health from the provider side. You've been an EVP at Optum from the payer side. You've been the CEO of One Medical and now at Healthier Capital from the innovator side. And finally, you are Amir. You are a patient, like all of us, right? So maybe with that, when you think about this term, the digital front door, what comes to your mind? What does it mean to you?
Yeah, well, what it means to me at some level is the front door has been closed for many people in healthcare. If you look at the demand side of healthcare, if you look at the consumer side, consumers are frustrated with their experience, with their access. A survey that we looked at a little while back showed 76% of consumers were dissatisfied with their healthcare experience. And in my old world of primary care, on average, it took weeks to see a physician. And today, consumers, if they ask questions at their health system or providers or health plans, it's often difficult to get the answer or access in a timely fashion. And there's often a lot of incorrect answers or delays. And then when you look at the supply side of healthcare, working with providers and people in contact centers, in health systems and health plans, we're seeing large levels of burnout. And family physicians, 68% of physicians show symptoms of burnout. We're seeing shortages of workers, predicted 10 million shortfall by 2030 in some studies. And we see a lot of administrative and clinical burdens. So the front door has a lot of barriers in front of it. And what gets me excited now is how we can leverage technology to both address the demand side frustrations. I can't get in, I can't get my answers questioned. And the supply side, there's too much friction around finding the right information, finding the right answer.
So maybe on that, in the friction, a few months ago, you went live on CNBC to share your thesis that AI is the key to healthcare disruption, a view that obviously you and I certainly share. Could you expand on how exactly you see this disruption taking place in an industry that, quite frankly, known to be challenging to disrupt? More importantly, where areas of healthcare do you believe can be drastically improved today rather than a decade down the line?
Yeah, well, I think what's so exciting about AI now and the opportunities is the technology is converging with these problem statements that all these stakeholders have. Meaning we can address the demand side frustrations by automating things. And certainly this is a lot of the work that Hyro is doing. Hey, I need access to information. I need to schedule an appointment. I have a question. That information is available, but today we've had to have people, humans, find that information. And frankly, finding it readily, getting the right answer. And healthcare is very complicated. You know, where is my referral or authorization, or how do I book an appointment for an epilepsy visit on this date, and where do I park, and how do I go, and what time do I come? Oh, and now after I have a question. There's a lot of steps in this process. So technology can automate this. We know the answers in health systems. We have the information, but it's hard to get that exposed in the right way to the consumer. And the same side, on the supply side now, we're seeing this technology being able to enhance our team members. We have this information. It can be available. We can make it readily available. And part of what AI and generative AI is allowing us to do is allow our people to focus on the human interactions and the more complicated issues. Let's talk about this follow-up. Let's talk about the issues you're feeling with this. Not like, where do I park? Where do I show up? And frankly, in healthcare, we're often spending so much energy and effort on the administrative and on the logistical parts of things. We don't actually have any energy left as humans to deal with the compassion. So this technology has now come of age, and we see it with what Hyro is doing, where we can help the consumer, help the team members, and it's working. So that's pretty remarkable. And that's partly what's changing, the convergence of these problem statements with technology now that can automate a lot of this work.
Yeah, obviously, we're very excited with AI as well. And I'm sure that many of our audience members are just as excited about this opportunity. But maybe at the same time, I'm sure that many are still, and rightfully so, grappling with reservations about the safety of AI applications, especially in any patient-facing setting. What do you say to these leaders, and how do you think that we can ensure the responsible use of AI? And maybe also to connect it to your role today at Healthier Capital, does this take any part of your decision-making process when evaluating where to invest next?
Yeah, it's an absolutely critical issue. I mean, it starts, of course, with kind of first do no harm. Healthcare organizations want to do right by their patients, their members. And then it's quickly followed by a regulatory environment that says, look, the regulations are unclear, but the penalties will be severe if you do harm, right? So healthcare organizations are right to be careful, cautious, thoughtful about it. And so what we look for at Healthier Capital and a lot of AI and generative AI companies are approaches that are thinking about this safety. And obviously, as you know well, this is what Hyro is doing. So, for example, one can leverage generative AI to infer and understand what the consumer is saying, but then not use just general generative AI to scour the internet and say, you want the parking for the GI clinic? I found a brochure somewhere online that says the parking is on the 9th floor. Well, and by the way, if I ask a second time, it'll give me a different answer. We don't want that. The parking is where the parking is. And so what some of these models like Hyro are doing is building these knowledge graph approaches where the answers to these questions will be consistent each and every time. And so that's a key part of it. So certainly that avoids the kind of hallucination issues. It avoids the kind of drift or change in the models or different answers over time. And you want that consistency. You also, as a healthcare organization, and certainly as an investor, but as a healthcare organization, you want the answers that you want to give. And there is customization. Different organizations are different. They might have different approach. And so being able to do that and track that and monitor that and control that is extremely important. So this safety issue for the consumer from a regulatory perspective, and frankly, just to get the right answer to people each and every time is extremely important. And that's what we like seeing in companies like Hyro.
Yeah, and I'm very opinionated about responsible AI, as you know, and I feel that Gen AI is all the buzz from 22 months ago when OpenAI released GPT-3 for the public. But I think that in healthcare sometimes, and that's a sentence that I find myself saying more often lately, Gen AI, the generative piece of it, is a bug. It's not a feature in industries such as healthcare, where, to your point, like in some areas, and you gave parking, the parking is where the parking is. Let's take it even one step further. Like if you're in an emergency situation, you don't want the AI to generate a new answer and make up stuff every time. It's the same old controlled response of call 911 or go to the ER. That's it, done, no generative. So I think that when I think about responsible AI, it definitely comes down to, I'd say, the control piece of it. To your point, like we have our own data sources, we know what is allowed to be said and what's not, and how do we prioritize them. So giving some more control to it. It's about clarity or explainability of AI, which is still a big challenge. I feel that large language models are still machine learning models, which are black boxes. So now instead of a small black box, we have a large black box. You still don't really understand what's happening inside. And finally, being a highly regulated industry, healthcare, we have the compliance piece. So everything related to patient health information and personal information and HIPAA and SOC 2 and GDPR. And I'd say even not only the regulation that exists today, but also thinking about we're seeing this, like future regulation of AI. It's coming, right?
No question. Those are great points. And at some level, healthcare moves at the speed of trust, right?
Yeah.
We are establishing trust with patients, with members, with enrollees, with our own team members. And it's hard to build trust, but it's easy to break trust, right?
Mm.
And so you build trust by being consistent, by being responsive, by being timely, by being compassionate. You break trust by doing the opposite of that, but also by being inconsistent, by giving different answers, by not being responsive. And we can break trust or not build it in human interactions, but we could also do it in computerized interactions. So I think that's the other key thing here. And just to reiterate a point you made, we don't want creative writing when I'm asking about my test results, or I need an appointment or change the time, or I need a prescription renewal. I need a prescription renewal, right? Like, and so we can leverage these incredible tools that we're having in AI and generative AI, for example, on language understanding and inferring what I said by voice and messaging and parse that out as Hyro can do. But then when we give the answer, we want to make sure that we're giving specific answers, trustworthy, consistent answers that aren't biased, that don't give a different answer depending on who asks it and how it's asked. And all of that is super, super important in healthcare. Again, different if you're just asking questions on the internet, you're looking for creative answers. But now this is my test results. This is my health. This is my child's health. This is my insurance, as I sometimes joke, an extra zero on the number makes a difference when you're talking about money.
Yeah. So I picked on Gen AI on the generative part. Let me also pick on the AI part. I feel, to your point, healthcare is an industry based on trust, and we see it on and on. And AI, meaning artificial intelligence, the word artificial, that word by itself, that creates some sort of lack of trust. And I hear a lot of healthcare leaders now talking about augmented intelligence. So it's not that machines are going to replace physicians, but that physicians with AI And again, think about it, artificial intelligence or augmented intelligence are going to replace physicians without AI. What do you think about that?
Yeah. Well, I love the concept of augmented intelligence. So I would agree with that. I think healthcare is complicated. The administrative process is complicated. How do I book an appointment? With whom do I book an appointment? Where do I go for that appointment? Do I need an authorization for that appointment? Is there prep for that appointment? Is there follow-up for that appointment? How do I get my questions answered after that appointment?
Mhm.
And so just the administrative part is complicated. And by the way, Hyro is it can help automate a lot of those things to make it less complicated. And then the clinical process is complicated on the clinician side, right? What is the patient saying? What am I hearing? How do I collect that information? What are the multiple sources for information? What didn't they say? What's happening in their life with their family, with their situation, with their job? How is that impacting? And then often the diagnoses and the answers are complicated. Well, you have a 17% chance of one of these four things happening over the next 16 and a half years. What do you do with that, right? Like, so we're getting to a point where maybe we can get to that kind of more probabilistic precision over time with polygenic risk scoring and better imaging and more ingesting of information. But how do you make a clinical decision, and how do you help advise a patient or an enrollee in a health plan? That's where we're going to need the humans. We're going to augment them with this information, but the choices, the values, the decisions on that will be complicated. Should the answer be different if somebody's 50 versus 90? Should it not be? Does it depend on the person? How about family situation? So we can use AI to help us simplify the administrative complexity, simplify the processes around this, help ingest and process clinical information. But I think we're still going to need great human interaction to help guide, interpret, and then certainly we will continue to need the great hands of the proceduralists, the surgeons, and others to help us as well. But I'm excited because this can really augment us. We have this constraint in the health system. We have these access barriers. We have these burnout barriers. And part of it is if we can remove a layer of this administrative complexity, we can get back to the human focus.
Yeah. And I can't agree more regarding the things that we see today that are already, I'd say, really closing the gap between the new patient expectations and what do they expect. Yes, Amazon-like experience in healthcare. No, I don't know. You have, again, a very unique perspective here. But on the other hand, like do it while in parallel working on the workforce capacity, shortage issues, burnout issues that you've mentioned. And I feel that we do see a lot of healthcare organizations moving towards this direction. And to your point, starting with administrative cases, which is still not easy, but definitely less risky than to start with clinical ones. But let me try to take you way into the future, right? So call it 5, 10 years into the future, right? Not what we're solving for today. What's your vision for healthcare in 10 years into the future? What's going to be changed here? What's most exciting trends that you feel you're seeing now that will mature in this time period of like 5 to 10 years, not the next 2 to 3?
Well, let me actually go back to my One Medical days, a modernized doctor's office, combined digital health and in-person care. And you mentioned Amazon. We IPO'd and then we joined Amazon. Amazon acquired us, and part of what One Medical was able to do is do a number of things. But people loved us for great access, great access. And I think now with these kind of tools like Hyro, we can get that kind of high net promoter score, high service experience, high access. Doesn't fix everything, but in these next few years, because there's tremendous frustration in access. And I often go back to a paper published years ago from a couple of professors at University of Michigan. They talked about the 5 A's of access. There is kind of availability, there's accessibility, there's accommodation, there's acceptability, and affordability. I think I might have hit all the 5s there. And so, we start thinking about a lot of the barriers. I don't know where to go, who to call, how to get in, where to park, if it meets my needs, if they'll see people like me, however that might be defined. And now we could very quickly, with this kind of technology that Hyro is offering, kind of give every organization leveraging this kind of the best of technology, the best of access. And because today we're like, hey, what's your wait time to answer that phone call? What's your learning management system? What's your turnover in your contact center staff? How are you training those people? The rules keep changing. How do you update that? Like, just that process management is very, very difficult to do. And we used a lot of lean and process and technology, but now one can have the very, very best in technology. And I wouldn't minimize how important that is to the consumer. I mean, there is a lot of suffering and burden.
You said consumer. You
Yes.
said consumer. Okay.
I did say consumer. That's true. And some people say consumer or patient, but or member, but that is a big part of the process. And a lot of people won't go to the next step because it's just too hard. I won't get my screening exams done. I won't follow up on my preventive care. I won't follow up on my chronic condition. It's just too hard to get in. It's too hard to navigate. It's too hard to find the answer. So let's take away that excuse. So I think we can not only delight the consumer here with a better answer, but I think we can actually improve preventive care, quality of care, access to care, because we're reducing those friction points.
When you think about improving preventive care, is it moving from being reactive to proactive, from talking with a patient to talking with a consumer or a person, and like having a more personalized experience?
Well, I think it's all of those things, but I also think we can, frankly, simplify and automate things. If I try to get an appointment somewhere, and I was the CEO at Stanford's Health System, COO at UCLA System, amazing organizations. It's not obvious for me who I contact, how I contact them, when I get a response. And it's not easy for them to know, what am I interested in? What's my problem statement? What am I looking for? So, that can be automated in many ways. So, that part is automatable and I think can be improved.
Okay, this is amazing. Amir, thank you so much for being with us today and kicking us off on this amazing conversation. Truly inspiring. Liat, back to you before the next session.
Thanks so much.
Bye-bye.
Thank you so much for that insightful session. Thank you, Amir and Israel. We now have a 5-minute break until our opening keynote with Ed Marks and Chris Ross, CEO of Mayo Clinic. Ed Marks is the CEO of Marks Advisory. We'll be discussing their book, Diagnosed. See you guys in 5 minutes. Have a great coffee break. And for anyone who is going to stick around, I would like to go over some housekeeping notes. So anyone who is here, and thanks, Amir.
Bye.
See you in the chat. Hopefully you can join us later today in the sessions. So I would like to go over today's agenda. Whoever's still here and would like to know some more information and what we're providing today as far as the sessions. So first of all, they will be recorded and handed out post-event for viewing. And I'm gonna share my screen and go over the agenda for whoever is here with us. Oh, thank you, Israel, you're already there. So Israel, next slide, please. Yes, so we just had that, and now at 10:30 we have our opening keynote. By the way, 5 lucky winners will be receiving a co-signed book by Chris and Ed, so stick around. After that, we dive deep into the CIO's Guide to Responsible AI. That's more of a practical session. Next slide, please. Then we do have two simultaneous rooms. So if you are a provider, you will want to join the left Piedmont healthcare session. And if you are in the payvider space, you'll be wanting to join our sales first folks who are going to talk to us about mastering responsible AI. After that, we have another two simultaneous rooms. So on the left, you'll see we're joined by Summa Health CIO Elbridge Locklear and David Wright of Disruptive Innovations. They'll be talking to us about the future of healthcare and human-centric approach. In the other room, that will be for payers. So our very own Brian will be moderating folks from Emblem Health and Select Health all around prioritizing health plans. Next, please. After that, of course, we're all going to be hungry. Grab your lunch and join us at our product session with Hyro's team, talking about the product roadmap, kind of a sneak peek. Then we split into two rooms again. So whoever's interested in a mobile-first strategy, join that room with our Baptist Health, Julian Ammon and Lee Jones. In the other room, we'll be joined by Taylor from Ballad Health to discuss Web UX as the welcome mat of the digital front door. Then we all come back on the main stage to join our amazing women CIOs who are transforming the digital front door. Next, please. And we then discuss call centers. After the call center session with Innova and NICE, we are breaking out again. Pediatric folks, do not miss this. We're joined by Omkar, JD, and Patrick to discuss caretakers with the digital front door. And the other room is really for IT leaders. I highly recommend this session. Last year, it was a full house with our leaders, Sarah, Pete, and Gretchen, all around kind of how to avoid misery as an IT leader in healthcare. So you don't want to miss that. Next, please. Then we've got our very own Reed. He's a great friend. Love this session. I was there prepping with them a lot. Tales from the trenches. So really to learn the lessons learned from CIOs. The other room is building trust, governance, policy frameworks, more diving into that. And we close off with a future-proofing closing keynote with Joel Vanko of Hartford Healthcare and Barbara Casey from Pixel, really leaving us with food for thought for the future of the digital front door strategies for 2025. And Israel will then be closing the day with some closing remarks. Next, please. Great. So we just had our panel discussion, and as mentioned, these sessions will be recorded for post-event viewing. I'm here throughout the day moderating the chat. If you have any questions, feel free. We highly encourage to join us live so you could ask questions. And that's it for now. So go grab your coffees, and we'll see you on the main stage for our opening keynote with Chris Ross and Ed Marks.